What's up? It's your favorite NPHP and welcome back to my channel. So today we're going to discuss a doctorate of nursing practice and how we are no longer going to be master's prepared nurse practitioners. So on April 20th, 2018, the National Organization of Nurse Practitioner Facilities, or the NONPF, made the commitment to move all entry-level nurse practitioner education to the Doctor of Nursing Practice degree by year 2025. Meaning in a couple months, specifically 10 months. They are doing away with master's prepared nurse practitioner. So let's talk about the difference between a nurse practitioner and a doctorate of nursing practice. A DNP, or Doctor of Nursing, is an educational degree, while nurse practitioner is a certification. A nurse practitioner is a master's or a doctorate prepared nurse who is certified and licensed as an advanced practice registered nurse, or APRN. A DNP is a higher education degree. A NP, or a nurse practitioner, can earn a DNP degree, but a DNP prepared nurse does not have to be a nurse practitioner. So while both are advanced degrees, the MSN degree focuses on developing nursing skills needed to become a nurse practitioner, while a DNP focuses more on policy, leadership, and administration. So NPs holding a DNP usually hold a higher level position, such as a nursing director or chief nursing officer. And a DNP is considered a terminal degree, and most nurses end their education after completing a doctorate. So here I compare the Master Science of Nurses versus the DNP degree. ADN to a DNP could be 5 to 6 years. A bachelor's to a DNP could be a 3 to 4 year degree, again, depending on full-time versus part-time schooling. A master's degree to a DNP is an additional 2 years. So right now I hold my Master's Science of Nursing degree. If I was to go back to get my doctorate or doctorate of nursing practice, it will be an additional 2 years. Renewal for your Master's of Science of Nursing degree certification is 1 to 5 years. It depends on your specialty. And we know that CEUs depend on your specialty and the state as well you live in. Whereas for your doctorate, renewal is every 5 years. With your doctorate, you retake the exam or you provide proof of at least 1,000 clinical practice hours and 75 continuing education hours. So the work environments for your master's degree versus your DNP degree. For your master's, you could work in hospitals, physician offices, in educational services, office of other health practitioners, long-term care facilities, community clinic, versus DNP. They work more in universities, public health office. They could also work in hospitals. DNPs could work in specialty practices, autonomous practices, healthcare administration settings, healthcare policy advocacy, and organizations. Individuals with doctorate degree can function in a provider capacity, but most work to generate new scientific and clinical knowledge in nursing and healthcare. Nurse practitioners practice primarily in clinical settings, and they do not focus on the scientific and academic research. So for this reason, most DNPs work in academia, administrators, and or research areas. You just think of nurse practitioners, we're more clinical, hands-on with the patient. DNPs, they're doing the research, more administrative, more academic work. I look at it more as a business side with the DNPs. But again, remember, you could have your DNP and still practice as a nurse practitioner. Well, obviously, because that's where they're moving to in 2025. Doctorate of nurse practice, nurse practitioner. Next, I listed some benefits of becoming or having your DNP. First one is DNP degree may allow nurses to advance their education beyond the master's level and develop expertise in their chosen area of specialization. You have more career opportunities, like in leadership positions and healthcare organization, and shape healthcare policies, like leadership and advocacy roles. DNP programs may strengthen leadership and advocacy skills, preparing nurses to take an influential role within the healthcare system, and then again, higher compensation. So to pursue a DNP, individuals already would have completed a traditional or accelerated BSN program and have a Master's of Science of Nursing. There are only a handful of programs that accept students into the DNP program without a Master's of Science of Nursing. These programs are bridge programs that offer BSN to DNP programs. Students will work to complete coursework for an MSN that then continue directly into the DNP curriculum. So an MSN program takes approximately 2 years full-time, while a DNP program can take 1 to 4 years. Overall, it is approximately a decade for a new nursing student to obtain all 3 degrees, BSN, MSN, and DNP. I did find top DNP programs in 2024. So the top programs are Johns Hopkins University, Columbia, Duke University, Rush University, and the University of Washington are the top 5 DNP programs of 2024. Online DNP programs that are popular: Grand Canyon University, Walden University, and Simmons University, Georgetown University, and Utica University. Some of you may be wondering, like, when this comes into play, what happens with the master's prepared nurse practitioners? It is said that we are grandfathered in. It's understood that current APRNs practicing with a MSN will be grandfathered in and not required to earn a DNP in order to maintain their certificate or licensure. That's good to know. I don't think it's a bad idea that they're now requiring us to obtain our doctorate. I mean, it's higher compensation and you're going to have better job opportunities, clinical, but as I get older, 10, 20 years from now, if I wanted to do more leadership role, having the DNP under my belt, I'll be able to obtain that versus right now. I mean, yes, they said I'm grandfathered in, but before these changes, it's like I would have had to go get my MBA business degree if I didn't want to get my doctorate to be more of a leadership role. So that's why I kind of see the doctorate of nursing practice more of a business. It's similar. It's similar to obtaining your MBA, your business degree. All in all, higher pay, better job opportunities. You could still obviously choose to be clinical and at bedside versus the next day if you want to be more of a leadership role, health advocacy, more research behind the scenes, and climb the ladder, becoming like the CNO of your healthcare system. You'll be able to do so when you complete your DNP. And I have to look more into it being grandfathered in, especially when it comes to renewing our license and things like that. So 2025, we are no longer going to have Masters of Science prepared nurse practitioners. It's going to be your doctor of nursing in order for you to obtain your nurse practitioner. Like, yeah, I don't think it's a bad idea. It is what it is. It's the changes that they're making. I will attach their full statement in my description. It has some good information in more detail about why they're making the decision, which proves that this will be the best route to go for our nurse practitioners here in the near future. It's time to end this video with a Bible verse. We are on John chapter 14, verse 7. If you abide in me, and my words abide in you, you shall ask what you will, and it shall be done unto you. So it's basically, if you abide in me, meaning if you trust in the Lord and you follow the Lord and you believe in the Lord, at the same time, His word, you follow His word, you believe His word 100%. What you ask for, basically, you shall receive. You shall ask what you will, and it shall be done unto you. If you're putting 100% effort in getting to know the Lord and getting to know His word, you're able to pray and ask for things and it shall be given to you. But you have to put forth the full effort and trust and believe that He's able to make miracles happen and move mountains for you. So if you're right now in a stage of wanting and needing some changes in your life, please abide in Him and abide in His word and pray and ask for whatever you shall want, and it shall be given to you. You have to put in the work and believing and trusting in Him and His word. So that should conclude this video. I just pray that each and every one of you are doing great. I pray that you continue to seek the Lord, find Him, trust Him, have faith. And when I tell you, you will see the miracles and the changes in your life that you've been praying for. So until next time, God bless.